Hi, everyone, and welcome to Lyfebulb Live. I am very excited about this because it's an area that I think I don't even know about. And I'm excited to learn from one of our amazing ambassadors, Ella, where we are going to be talking about health literacy. What the heck does that even mean? What is health literacy? I'm so curious to know what this means and how I can be more literate. Ella, thank you so much for joining me today. And could you tell us just a little bit about yourself and how you got here?
Yeah, absolutely. And thank you for having me. My name is Ella Balasa, and I am a patient with cystic fibrosis. And this, for those that are unaware, it's a genetic lung disease, and this causes the buildup of mucus in the lungs, and then over time leads to lung infections and then deterioration of like lung tissue and a shortened life expectancy. Over the years of growing up and having to be hospitalized a lot and just receiving a lot of care from doctors and understanding my own condition, I have learned the power of advocating for myself. And that combined with having a background in biology and really having an interest in merging, understanding research and healthcare and applying that to improving my own health outcomes has allowed me to further my advocacy efforts. So, most recently, I've worked with the CF Foundation on a number of research committees, and I now actually work with Lyfebulb as well as a clinical editor, working on summarizing clinical information for layperson for patient consumption to improve health literacy. And that pretty much sums it up. And I'm looking forward to this conversation and sharing what I know and what I
Awesome.
plan to do.
So, first of all, I just want to say thank you for explaining cystic fibrosis because I do think that is really important. I think people hear these words a lot, MS, lupus, and you don't really know what it is. Like you may have a general idea, but to really know what it is super important. And
Right.
I really appreciate you giving that definition because that made my day because I just think that it's important to be educated, which brings me to my next point. What is health literacy? Tell me what you mean by this. Tell me, please.
So,
I want to know
well,
if I'm literate.
the definition is the way, or it's like the degree to which individuals have the capacity to understand health information
Okay.
to be able to make health decisions for their own care. So, this means that, I guess, in a nutshell, we're giving examples. It's understanding research, understanding the science of your condition to help you be able to have conversations with your doctor on what is the best course of treatment, why something might not be good for you, and understanding all of the options and really helping you to be a co-partner in care and not just being told, oh, this is what you should do, and then you're like, oh, okay, like I guess that makes sense. You're making the decision based on a foundation of understanding that you have about your disease.
So I guess it's kind of where I was going at with it. And I think that like I feel like I'm pretty on top of my health. But then it really like you really got me thinking about what this means. And on we have transplantlife.com
Mm-hmm.
and on Transplant Life we have a health tracker, okay? And we can measure our bowel movements, our activity and
Mm-hmm.
everything and I'm like, gosh, is that being health literate? Like really understanding your body and the metrics that is involved in it. And I think that is where most people go a little flat. Like I don't do that all the time. And every time I go to the doctors, they all say to me, how's your bowel movements been? How is your, and I'm like, okay. I don't even know what to say. But then I realized as this conversation was coming, I need to be more literate that way.
Yeah, that's certainly an aspect of it. I think us being like self-aware and being able to share what we know about our own bodies and about our symptoms to our doctors helps to, or to the healthcare community as a whole, just helps to have a better conversation when we're understanding what steps next to take in our care, and what would be the best course of action. So
Yeah.
yeah,
And
go ahead.
so on a regular, like how many people do you think actually are doing this?
It's a good question. I think those that take, I don't know if the word is responsibility for their own care, but people that are invested in their own health and in, having the best health outcomes for themselves as they can, and knowing that they have it, knowing that they have some control over that. I think that's where a lot of people think that, their disease or their condition just happens to them and they can't do anything about it. And it's sort of like I don't want to say it's like a victim mentality, but yeah, our diseases are not fun. Like, we would definitely choose not to deal with the stuff that we go through. But I think understanding that we can try to do the best we can with it, whether that is tracking our symptoms for us to learn more about it, to then alter what we do with our care teams because of that, or whether that's just understanding more about research so that we can maybe think about some other options. I think it's like a level of responsibility that we have for ourselves to do that,
I
for our best
love,
health.
I just adore you so much, but I love what you just said because you gave different levels for people. There is some people that really are going to dive right in and read the clinical aspect of everything and understand all the, the real nitty gritty medical terminology, all of that meat, right?
Right.
And then there's people that are just going to need the basics to get them through and to have them really comprehend what they're going through. But then
Right.
you do have this other group of people that they may not want to or can handle knowing all that there is to know. They just can't. I don't think there's anything wrong with that. I'm not knocking anybody for that. But having some sort of knowledge base, I think, does empower you to get through your illness, your disease a little bit more thorough. And I just want to ask this question because I think that it's a good point, and I know you don't know the answer. And for the record, it's not like Ella is like Miss Health Literacy, extraordinary or
No,
professional.
I'm
She
not.
just has educated herself a lot about this, and that is where I think it's important. But what about our care partners, right? So if you have a great care partner, someone who's taking care of you, if they want to invest that time and really find out about your illness and help educate you in a way that helps your mind work, there is nothing wrong with that. What do you think?
Yes, absolutely. I mean, I think we all need care partners that do that. Like, I think that's half of it. When we are empowered, when we get that empowerment and support from our care teams, that only makes us stronger. That like we have people that are lifting us up and backing us and pushing us to be able to do better and be better. And I think that that dynamic sometimes, just because of people's personalities and misunderstandings, maybe sometimes that doctor to patient relationship isn't the best, and that is really unfortunate. But for I think, just to say briefly, I think that for those physicians out there, I think for them to be the most compassionate and just genuine in their interest and in wanting their patients to be able to speak for their own care and for themselves. I think that every doctor ultimately wants that because it makes their jobs easier too.
It
I
does
think
make their
some
job
just maybe
easier.
know how to do it better than others, and I think that's just something that we all they can strive for, and as a team.
Yeah, for sure. So this is actually what you said is the perfect segue to bring in our CEO. Karin is going to join us. She is in her car, but she is going to take some time
Hi.
in between her appointments to join us. And Karin, I think this is a perfect time for you to join. We just were talking about how there are different levels of health literacy, right? You have people that are really, really, they want all the meat, the the nitty gritty part of their diagnosis, all the clinical things and the medical jargon, so to speak. And then there's people in the middle that just want to be educated. And then there are people that it's just overwhelming to them. However, you're a different one because you're also a doctor and you have, a huge medical background. So your literacy is completely different than mine or even Ella's for that matter. And how do you, as a patient and a doctor, navigate that and balance that?
Well, I think I'm a very difficult patient. I come into my doctors very much assessing the doctor as much as they're treating me, and I really am tough on the doctors because they're there, for us. I'm the customer, I'm the client, and if I'm not happy with my doctor's behavior, education, way of presenting, way of dealing with it, or the way they take charge to a certain extent, I'm not going to come back, and I will let that be known as well. So, and I think everyone has that right. It's not just because I'm educated or I'm experienced and I have a personal interest in it. It's the right of everyone. When we go to a hotel, we go to a restaurant, we have certain requests. We do it politely. No one should be a bully, but they're there to serve us, and they're not there to be gods. Although I do have to say, when I go and see a doctor, part of what I really look for is also confidence. Confidence comes with knowledge, and a doctor who's confident without knowledge, is worse than one who is, very, modest and may have some knowledge. So a young doctor who is too confident makes me scared, because being a physician is, not sure what it's a craft to a certain extent. You need to do it often. The best surgeons are those who have done thousands of operations, not the one who's doing it for the first time. However, the best ones are also those who are relatively, strong physically still and mentally. So you don't want a doctor who's too old and, complacent either. So I do think we can set our expectations, we can have demands, but it also means that we need to put demands and pressure on ourselves. With that responsibility comes accountability, I was told by a wise person. And I think that it is our responsibility to take charge of our own healthcare to a certain extent as much as we can. And that means that we should get educated. And I think you're right, Annmarie. Some of us may have that education. Some of us are interested in it, and some of us have the capability, and others may be overwhelmed. But we need to take it in small pieces then, and learn at our level. And that's what Ella, for example, and I try as well, and you do as well. We try to speak to others, at the level that they're at. We try to educate because, as we say often at Lyfebulb, educated patients are better patients. And education, connectivity, and innovation lead to empowerment, and that's what we all want to become, empowered patients. So I do think that education is very important. I think health literacy is very important, but it needs to be delivered to patients in the portions that they can accept and at the level that they can understand. And nothing of that is derogatory or disrespectful. It's just that we are all different, because it could also 100%. Be that it's the smartest person or the most educated person, but at the time when they get their diagnosis, they're overwhelmed. So they need to be told, they need to be educated over and over again, and often also together with a care partner who can hold their hand and can listen and can then repeat. So it's complex, but I do think that as patients, the more educated we are, the more health literate we are, the better we become as patient, and that's good for us. So
for sure,
that's the ultimate goal.
I don't think it could have been summed up better.
No, I totally agree. And you said a couple things that I think are important. A good doctor, that will listen to you and let you ask those questions and answer them back to you in a way that you can understand it based on your level. I remember when I was first diagnosed with cancer, I brought my best friend with me. She was a cancer research scientist. She was asking the doctor questions. At one point, the doctor looked at her and goes, "Are you a doctor?" And she's like, "No, I'm a scientist." But I didn't know what to ask. She taught me how to ask questions in a way that I needed. And then she also kind of pushed those doctors to answer them back to me in a way that I understood at that moment. I mean, granted, my knowledge about things have changed based on, how many years I've been in this. But in the beginning, I couldn't handle that influx of all that information. And I think that is where a lot of patients get scared off of being health literate, because it's so much information at first. You almost have to sit with it, let it digest, and then add yourself to it for a lot of people anyways.
And I think the key here is the point of the self-confidence. And when we, as we gain more knowledge about our care, about our health, the more confident we become in relaying that to our physician, in being more assertive on what we need, in asking, kind of what Karin said, in asking them what they can do for us, how they can help us. So I think that confidence is built over gaining more experience. And the more we do things, the more we push out of our comfort zone and ask those questions and learn more about maybe something we don't know about our health, about research, the better patients that we become.
Absolutely. I think you're absolutely right. I also think that we should prepare when we go to a meeting, I call them meetings, but they're really supposed to be appointments. But for me, it's always a meeting between, not equals, but there's a certain respect from both parties, right? So we need to be educated about what we are asking, what we're looking for. We need to know what we're looking for. To me, every single moment in life has to be used properly. I don't like to waste time, and I don't like to waste other people's time. So when I get into a doctor's appointment, I'm prepared because I may only have 10 minutes. So I know what I want to get out of that doctor. I know what they're good at. I'm not going to waste my time by asking a super surgeon about mental health, because that may not be their strength. I may not ask a psychiatrist about how to do surgery either. So we need to focus on what they're good at. And they should also be prepared. Nothing irritates me more than when I go to a doctor, they don't look at me. They look down in the papers and they start asking me about my history, which they should have studied, before they meet.
Yeah.
And they need to hear it from me. So I understand that. That's part of the process. I need to tell my story. I don't want to tell it 4 times to 4 different people. And then it's still not interpreted correctly. So, being prepared ahead of a meeting, I think, is guidance both to patients and to doctors, and anyone in a business meeting too. You don't go in and deliver a presentation without being prepared.
Absolutely.
I had this doctor, obviously will remain nameless, but he had ordered for me to have a full hysterectomy because I had precancerous cysts on my ovaries and whatnot. And about 2 years after, maybe it was 3 years after that, I was going for my checkup. And he looked at me and said, "So how's your menstrual cycle now?" And I looked at him and I was like, "About as good as yours, buddy. You gave me a full hysterectomy 3 years ago." And how can you not know that about your patient? Why are you asking that question? That was literally when I realized I cannot have this doctor anymore. He is not invested in me. I need to leave. And I knew that before, but Karin, you had said something about them physicians being good at their craft. Being good at your craft is also understanding your patient and knowing your patient. But as a patient, we have to understand that we don't have to have that doctor. I love the analogy that you used about food service, because it's so true. We're going to these physicians for a service. And if they're not providing us the service that we need to go elsewhere.
Absolutely.
Which is hard.
That is so disrespectful to you as a patient, as a woman, as a human being. I mean, I would be so outraged. It's really horrible. He really hadn't, I understand you can't remember every patient when you see so many patients, but he should study. He should prepare for the meeting. And you know what? He should have remembered. It's just
100%.
It's something that is so intimate, so important to you as a person, is really pretty horrific not to remember.
Yeah, it was when I realized that I knew more about my health than he did. And you are right. I don't expect him to know.
So, Annmarie, I would stop you there. You should always know more about your health than the doctor. He
Yes, I agree.
will only know the very specifics that he or she is a specialist for. So if you go and see
You are right.
gynecologist, it's really about your female parts. If you go and see your
Right.
dermatologist, but you are in control of your health and you need to
Mhm.
take that responsibility. And I think every patient, if you do that, you can become better patients, you will have better outcomes. You need to see yourself as the expert, and the doctor is privileged to meet you to learn more about your specific situation, because they're also training.
You're absolutely right.
Yes.
Anyone who's watched an episode of Grey's Anatomy, you see how these young residents, they want to attend every single surgery because they want to see more of them. They want to see the unusual ones. So when we as patients who have gone through serious things, when we go and see doctors and we see lines of young people there who just want to interview you and learn about you, we know we're bringing knowledge to that's their craft. They're learning by seeing, by doing. See one, do one, teach one. That's the medical mantra.
You're absolutely right. And I think part of what we need to start doing is reminding people exactly what you just reminded me. It's not so much about me knowing, my doctor knowing everything. It's about me knowing everything about my health. You're absolutely right. And that, I think, is really hard for some people. And I think we brought up a couple good points that I think need to be shared. One being is do it in increments. You don't have to do everything all at once. You don't have to learn it all at once. Two would be, if you don't understand what is being said to you, ask. You have to ask or research it, because there are a lot of things. Sometimes my doctor will throw out numbers of, my CA 157, and I don't know what it means all the time. I have to go and look that up myself. And being prepared, Karin, I love that you said that. Like, be prepared going into your doctor's office. Before you had come on, we talked about the health tracker that we have on Transplant Life. Like, having all of your information ready so that you don't have to be like, oh, well, let me think about that on Tuesday. I ate blah, blah, blah. No, come in and say, this was my meals. This was my health. This was my exercise. Be prepared with your information. What do you guys think? What would you add?
Yeah. I mean, I want to say something, because I think that it's important that we understand that we are our own experts. However, the doctor's added value, beyond, so many added values, but the most important is that confluence of, the knowledge that they have based on seeing so many different patients and reading so many books and so many articles. Okay, so when we come in with all that knowledge that only we have about our bodies, the way we feel, the way we behave, and we can bring that, and we need to bring that in totality. The doctor can process it, analyze it, and compare it to articles, to other patients, and then draw a conclusion. And that's the value added of a strong doctor, is that they can bring all that together and then come to a conclusion and then treat. So, the treatment is not our expertise as patients. That's the doctor's expertise. But our expertise is really all the symptoms and all the way we feel. And we can bring that together with our data. When we have our data, as we do with the health tracker at Transplant Life, we can really become very powerful, and that's what leads to empowerment in my view.
And I guess just
that.
Just playing the devil's advocate here, I think that we also have to remember that, yes, we have our data and our understanding of our bodies better than anybody else knows, for sure. And remembering that, as you said, Karin, in combination with the doctor's expertise on seeing these cases in other patients and seeing trends and providing that perspective, we need to make sure that that we are considering their opinions too. I think that it's very important to be our best advocates, be empowered, but then ultimately make that decision together. And if our doctors, and if we have that good relationship and that trust, that foundational trust built, where we know that this doctor has our best interest in mind. And maybe if our opinions differ based on, his recommendation or what we believe, evaluating that and putting enough weight on his opinion as well as our own. So I think just remembering that.
I don't think you're being devil's advocate. I think you're essentially summarizing what I just said, because I think that we are the experts in our symptoms and how we feel, and they are the experts in analysis and comparison and actually drawing conclusions. So I think
I guess just meaning not to also think that we know everything and we can't, and we don't need to rely on our doctor. And
very, very good point.
We need them 100%. Otherwise, we would only be an N of 1. And an N of 1 is just a case. We need the totality of all the information to be able to draw conclusions and then eventually treat and hopefully maybe cure. But very rarely do we cure.
And truthfully, we need to be more honest with our doctors. That's a really hard part for a lot of people, is being really honest, explaining those symptoms, not feeling ashamed or not feeling like you're complaining again, but really, really be honest. I'll tell you, once I realized how honest I needed to be with my doctor, my health totally changed for the better, not for the worse. But well, this was a really enlightening conversation, and I kind of knew what I was going to be, where you were going with this, Ella, but I'm glad that I wasn't 100% sure, because I feel like I did learn some things, which that is something I think we all, even right here, need to remember, that we are still learning through all of this. We are still learning through our diagnosis. Every day we're adding some more tools and some more value and some education to ourselves. And the best way to do that is to have conversations like this.
Well, thank you for having me. And Karin, thanks for joining us and contributing to our conversation as well. And I'm thankful to be an ambassador and to be having this talk with you all today.
Thank you so much. This was a pleasure. I really enjoyed it. Thank you both.
Me too. I'm glad you came, Karin. Yes. Thank you again, Ella, for being our ambassador and for being part of this conversation. Thank you so much.